With a pandemic-weary public looking for signs of a return to normal, the Biden administration is coming under some fire for what people say is its inconsistent messaging on COVID, with Dr. Anthony Fauci saying this week that Americans could still be wearing masks in 2022 and declining to say whether people who are fully vaccinated are safe to spend time with grandchildren and other extended family members. My next guest made headlines recently when he predicted in a Wall Street Journal op-ed that the U.S. is nearing herd immunity from COVID, saying he expected the virus to be mostly gone by April, allowing Americans to resume normal life. Dr. Marty Makary is a Fox News medical contributor and a professor of health policy at the Johns Hopkins Bloomberg School of Public Health. Dr. Makary, welcome, and congratulations on that op-ed, which was ahead of the pack, shook some folks up, but you have got some pushback from some people on it. Are you still sticking to that April timeline?
Yeah, it's going to depend on the geography, Paul. Parts of the country will be there in April, parts in May, but the general sentiment that natural immunity from prior infection was massively underestimated is now being affirmed by a lot of studies that show there's a lot more T-cell immunity than there is antibodies out there. And if you look at the rates of new vaccinations, we're doing pretty darn well, and we're on track for herd immunity in late April or May. If you look at North Dakota, they've already hit herd immunity. You've seen a massive slowing the infection, a week without any deaths. And it's going to depend on the geography and how well we do at the vaccine rollout.
And your definition of herd immunity is what? The combination of vaccination and previous infection at about, 70% of the country? Because Dr. Fauci said it's more than that.
Yeah, so Dr. Fauci and some of the other old guard medical establishment have dismissed natural immunity from prior infection. And so that's how they arrive at their July or December calculations on when we hit it based on the vaccination rates. But the reality is that herd immunity is not binary. It's not an all or nothing thing. And you start seeing significant slowing when a lot of people have had prior infection. The vaccination rate right now is going up by about 4% per week. And it's not linear. We're seeing mass vaccinations scheduled for anybody who wants it as early as end of March in Connecticut. And I think you're going to see certain parts of the country hit herd immunity in April.
Okay, now what are the implications of that when you're talking about social distancing, masking, going out in public? Are we going to be really wearing masks until 2022?
No, and we need to live our lives. The question about once you're vaccinated, can you be with loved ones? Can you go out for dinner? Can you do activities? The answer is a definitive yes. People need to get out there. We need to address one of the great epidemics of loneliness that's been magnified that affects health outcomes. So right now we need to talk about how to restart our lives and not do what we've done most of the pandemic, and that is a reactionary approach of, oh, this is where we are. Let's scramble to figure out what to do. This is a good time for us to plan getting back to normal.
And does that include, when you say getting back to normal, does that include attending mass events like concerts or sporting events, that sort of thing?
Yes, it does. We're going to see a lot of mass public gatherings. We're going to see a lot of semblance of normalcy starting later this spring. And it's understandable if the day that we go below 5,000 cases a day and less than 50 deaths in the country, if people are not ready to flip the switch back on, it's been a rough year. It may take a while for consumer confidence to pick up again.
How worried are you about these emerging strains of the virus, mutations, compromising the effectiveness of the vaccines? I guess so far not too much, but it's going to continue to mutate.
Yeah, this is something we follow carefully, but the message has got to be clear. Our tools are 100% effective against the new variants. And if you look at the countries where the new variants are very common, the UK and South Africa, they have had reductions in daily cases greater than we've seen in the United States. We've had about a 77% reduction in daily cases. They've had an 82 and 90% reduction in cases, respectively. So the variants are something we watch carefully, but at a certain point, the virus sort of mutates itself out of existence. So it's not like the variants are always going to be worse. It goes both ways, and coronavirus will be with us for a long time as a seasonal virus. But right now, the vaccines appear to be 100% effective against death, 100% effective against hospitalization once you're 35 days out from that first dose.
Well, Moderna, I saw, is already investigating a potential booster shot vaccine that could deal with whatever the virus throws at us. Is that going to be our future, perhaps and Americans are familiar with that with other diseases. Are we going to have booster shots perhaps in the future, maybe on an annual basis?
I don't think it'll be annual because this virus is more stable compared to, say, the influenza virus. But yes, and you're right, Pfizer announced their new phase 1 trial that they started, calling people from the original trial, giving them a third dose 6 months later to see if it gives better coverage against variants. And also Moderna developed a vaccine. This is big news, not relatively uncovered this week. They developed a new vaccine designed for variants, and that is a new mRNA vaccine. And they actually shipped it to the NIH. They developed it in about 30 days, faster than the first vaccine they developed in 42 days. So it does show our ability to respond quickly to new variants.
All right, Dr. Makary, thank you. And then we sure appreciate that optimistic assessment.